Now we are looking at the bone tumors. The bone tumors and their most common location. So to begin with, first we ask some questions. The questions are, in case of the echondroma. So in case of the echondroma, what is the most common site? The second question is, in case of the osteoid osteoma, what is the most common site? So I'll look at the answers of these questions and learn in detail. So to begin with, first we have the simple bone cyst. So simple bone cyst is mainly found in the proximal humeral metaphysis. Then we look at the echondroma. So where does the echondroma stay? The echondroma is present mainly in the hands. So if you say hands, what part of the hands? Perhaps it includes the metaphysis of the small bones. Metaphysis of the small bones of the hand. Next we also have the osteochondroma. So where is the osteochondroma present? So osteochondroma is present in the distal femoral metaphysis. So the distal femoral metaphysis is where the osteochondroma is most commonly present. Next we move on to the that is a osteoid osteoma. So the osteoid osteoma, this is most commonly seen in cases of the diaphysis of the femur. Then comes the osteoblastoma. The osteoblastoma. So the osteoblastoma is present in the posterior column of the vertebrae. Posterior column of the vertebrae. And then we look at the osteoclastoma. Osteoclastoma. So osteoclastoma is nothing but it is the distal femoral epiphysis. It's present in the distal femoral epiphysis. This is where the osteoma is. Then we move on to so this was osteoclastoma, which is present in the distal femoral epiphysis. Next we move on to the aneurysmal bone cyst. So the aneurysmal bone cyst, it is present in the long bone metaphysis. Long bone metaphysis. Next we move on to the osteosarcoma. So in case of the osteosarcoma, this is present in the distal femoral metaphysis. Distal femoral metaphysis. DFM. Then we look at the Evans sarcoma. So where does the Evans sarcoma located? So the Evans sarcoma is present in the diaphysis of the femur. So it's present in the diaphysis of the femur. Then what about the chondrosarcoma? So the chondrosarcoma, if you see, it is present at any site in the bone. It is present at any site of the bone. And most commonly it is present in the proximal. It is present most commonly in the proximal femur. Then we look at something known as a clear cell. The clear cell chondrosarcoma. So where does a clear cell chondrosarcoma located? So here, this is located in the proximal femoral epiphysis. Proximal femoral epiphysis. Then we look at the adamantinoma. So where does the adamantinoma locate? So the adamantinoma is present in the diaphysis. Diaphysis of the tibia. This is where the adamantinoma present. Then we look at the fibrous dysplasia. So fibrous dysplasia is seen in the upper end of the femur, most commonly. Upper end of femur greater than the tibia. Then we focus on the chordoma. So where is this chordoma present? It is present most commonly in the sacrum. And then where is the multiple myeloma present? So the multiple myeloma is most commonly present in the vertebra. Now we'll be moving on to answering our questions. So the first question we asked was, where is the enchondroma present? So when we look at the enchondroma, the most common site is nothing but the hand bones. So by hand bones, we mean the metaphysis of small bones of the hand. So the metaphysis of small bones of the hand. So the next one we saw is the osteoid osteoma. So where is the osteoid osteoma present? The osteoid osteoma is present in the diaphysis of the femur.